Uh, okay. Dear Dr. Stark, James Smith, writing to refer James Smith. Okay, James.
We don't see your screen.
Okay, it's my bad. Okay. I'm writing to refer James, or you can say James Smith, a 16-year-old high school student. Uh, okay, we just use hyphen. Okay. Um,
And one question at the beginning: if the patient is like child, like this, or even younger child, like a 5-year-old child, do we use the first name or last name? Like, not at the beginning we use the both, but when we continue writing for the like adult, we usually say the last name. For the
mhm.
child, do we say the first name or last name?
Yeah, we say for children we use the first name both in speaking and writing, and for male children we use master. For female children we use miss. So Master James Smith. So, and he say I'm writing to refer James, a 16-year-old high school student who has been diagnosed with cystic fibrosis since 2005. Um, um, for assessment of suitability for double lung transplantation. Okay. Um, good. James presented on um, James presented on 2nd of the February 2019 complaining of severe dyspnea, hypoxia, hemoptysis, and um, fever, headache, and facial pain. Although his vital signs were normal at presentation, the respiratory rate had increased to 30 per minute. Um, is so respiratory rate is a vital sign. So uh,
Uh, I mean, after that, at the first presentation, vital signs were normal, and then when he was in emergency department, suddenly
okay.
respiratory rate had increased.
So
I
it increased then. So
agree.
the respiratory rate increased to 30 per minute,
I thought.
and auto saturation dropped to 80%. Upper respiratory infection and chronic sinusitis were suspected, and ampicillin, sulbactam, and supplemental oxygen were initiated. Okay. One day later, or the next day, James's condition stabilized. Uh, James's condition stabilized. Chest X-ray revealed pleural effusion and pneumonia, and CT scan showed chronic sinusitis. Today, clinical situation is satisfactory or was satisfactory. So antibiotics were discontinued. Since there is an increase in possibility and frequency of lung infection, it was recommended to lessen time in school and to increase hospital visits. Actually, it's the opposite. Um, uh, okay, he was also referred to dietitian. We will discuss this. He was recommended to do this and that. Okay. Um, in regard to past and social medical history, James leads a sedentary lifestyle, and uh, and he's overweight. We don't want that. His BMI is okay. Mm, and his BMI is 28.5. He has a history of symptomatic
Seizure, doctor. I have
focal epilepsy,
a seizure. Yes.
focal seizures. Okay. Uh, for which he has been taking phenytoin 100 milligrams 3 times a day. His other medications include palmozyme. It's because it's a, trade name, 25 milligrams BD and Creon. And that is also, I think, regarding James's medical condition, I would appreciate if you visited him for your expert opinion about suitability for double lung transplantation. Okay. Sincerely yours. Well, the first word is capital. Okay. Good. How do you feel?
Um, I exceeded 200 word, which I feel it's not so important. Uh, Again, uh, I think the structure is kind of fine. Uh, Something not bad, not good.
Okay. Okay. All right. Okay. This one about school. So um, we discussed his reduced school attendance uh, and increase in hospital admissions and talked about the possibility of homeschooling. Okay, so it means that he doesn't go to school anyway, and he has to come to the hospital so often, and therefore probably it would be better if he has homeschooling because he wouldn't catch infections, and then he actually would have his schooling as well. Okay, so that was the I think that was what was meant with that. Okay, let's look at yeah.
At this point, if actually writing this matter of school and reduce school time relevant to the surgeon who are about to actually assess the surgery of his lung.
Mm, as what we're trying to do is to probably show how much impact is has on
Yes,
his life. Okay, and basically, yeah, I would probably also refer to the growth and growth retardation that he has had.
yes,
So yeah, we will talk. We will discuss that in a minute.
yes. Thank you.
Okay, so okay, this one track changes. Okay, dear Dr. Stark, I'm writing to refer Mr. James Smith. Okay, we say master. Okay, so master James Smith, um, which has been diagnosed with cystic fibrosis since 2004. I think that was 2005.
2006.
Yes, this is yeah,
Yeah,
this is the
yeah.
actually
I did the
date
master.
of
Yeah.
birth. Yeah.
بين فقهاء اختلاف نظر.
Yes.
Okay, for evaluation of suitability for bilateral lung transplant. Okay. James was admitted with severe dyspnea. Okay. James was admitted with severe dyspnea, cough, hypoxia, hemoptysis, fever, and facial pain on February 2nd. On admission, he had a stable vital signs and no fever. But you said he had fever.
It was
Yes,
hat fever?
yes.
It was 36.
At presentation with dyspnea, fever, facial pain, dyspnea, hemoptysia. Yes.
Okay. Yeah, I'd just say. His chest X-ray showed pneumonia, and paranasal CT scan was compatible with chronic sinusitis. He was treated with, or he was started on a 2-week course of. He was treated with a two-week course of 2-week. 2-week course of antibiotics, including azithromycin and ciprofloxacin. Well, I think at first he was started on
Yeah, it was
ampicillin and
one. I
sulfite.
didn't know if I should I include that one because there was like one day of another antibiotics and then switch to this one. I don't know.
I think the second antibiotic is not so relevant. The first one, which shows the actually, uh, severity of the disease, might be more important.
Okay.
Because the doctor, including both of them, could be, time consuming and also make the letter very big,
Okay.
more
Yeah,
than.
we'll come back to that. Okay. Patient has a symptomatic focal epilepsy. Okay. James, we don't say patient, okay? We want to see it's a human. Has a symptomatic focal epilepsy, which is currently treated by phenytoin, other medications. It's just an O we need here. Medications. Other medications include Panadol, Palmozyme, and Creon. James is a high school student with sedentary lifestyle, okay, and BMI of 28.5. His father died of lung cancer. He has no history of allergy, no known history of no history of any. He has no known allergies, and okay, no history of allergy. Okay, I really appreciate if you. We don't say really. I would appreciate if you visited, or if you could visit, if you could see James and provide us with your expert opinion on his suitability for bilateral lung transplants. Okay. Right. Sincerely yours. And 142 words. So what is missing?
I think I didn't include the any much more detail about the treatment and presentation and first treatment. I didn't know if should we include that one or no.
Okay. So how old is James?
18. It's a
No, no,
16,
16.
16, sorry, 16, yeah.
16. 2004. 10 to 2019. 2. Okay, so 15. Okay. So the 15-year-old boy, and he has cystic fibrosis, and we want to. GP is referring to. Yeah, is it GP or somebody else?
Emergency medicine physician. At the
Okay.
first, it was mentioned that you are a physician working in emergency medicine. Yeah.
Okay, so you are an ER physician and you're referring to cardiothoracic surgeon? Uh, okay. So why? What is the reason?
To assess for suitability of lung transplantation.
For lung transplantation. Uh, okay. Suppose you're a surgeon, and I'm calling you and said, "Hello, doctor. I have a patient and I would like you to see. This is a young boy of 15 with cystic fibrosis that I want you to consider for lung transplantation." What would you ask me?
Um, so the severity of disease actually, and how this disease affect his life, and the possibility of having another attack, another actually severe attack of pulmonary infection or pulmonary insufficiency. Uh, that that's it.
Okay. Right. So basically, the first thing you ask me is, why do you want me to consider him for lung transplantation?
Yes.
Yes. Okay. So, and I can say, well, it's the reasons that you say. So, the first thing is, why do you think he needs lung transplantation? So that is a key information now. So what we need to do is to justify the reasons that we think he needs lung transplantation. So what are those reasons? Then we need to decide. You said severity of the disease, the effects on the activities of daily life, possibility of the attacks, and the recurrence, and the fact that it keeps coming back. So, so what is irrelevant is, well, when he came back this time, how much is that relevant to the cardiothoracic surgeon? What he had on admission, what his
Severity of
situation was.
The severity of present illness, that
Mhm,
present illness which actually contain the auto saturation, which was low, respiratory rate which was increasing.
mhm,
Uh, Again, might be the physical examination of the lung,
mhm.
which revealed wheezing, crackles, something like this, which I omitted actually to make the letter shorter. And also the antibiotic he had to take, which was a broad spectrum antibiotic at the first.
And then was that something to cover Pseudomonas or was
Yes,
it? Yeah.
ampicillin sulbactam.
And so and yes, that is very expensive anyway, and it is also with a lot of side effects. So in a way, the severity we say the presentation, he was going towards respiratory failure. So the presentation was severe. Antibiotics are for pseudomonal infection. Um, okay. And then it also affects his growth and development, and it has also affected his daily life and his schooling. Okay, recurrent hospital admissions, which is also a lot of cost, and then possibility of other attacks, and he actually might die because of respiratory failure. So it is high risk, it is high cost, and it all is also impacting him. So That is the reason we want lung transplantation. So this is the relevant information. Okay.
Yes.
So in that case, do you think you would change any of your writing?
Yes, I think I include more details about the like presentation of patient and antibiotics that he receives.
Yeah.
Yes.
This for me. Yeah, yes, doctor. The first thing is growth retardation, but I think at because he's 15, 16, 15 years old could be relevant this because uh, actually he surpassed the time of growth, the effective time of growth. After 15 years for boys, maybe I step in too detail, but yes, growth retardation could be important. I mean, if the age of this patient was 8 or 5 years old, growth retardation could be more important than 15 years.
Absolutely. Yes, but in any case, it is still important because he still has got some time, probably 3-4 years. Uh, in any case, his BMI is 28.5. So basically, he's wasted. So, but I think yeah. So one something that came to my mind is that we have to make sure we get the details right, because with a mistake like this, you will lose your mark, even if you have paid attention. Okay. And in fact, is it important how long he has had cystic fibrosis? Is it that important to put it here at the
Yes,
beginning?
doctor, I think so because it directly affect the complication of cystic fibrosis, like uh, pulmonary failure, insufficiency, because of many time. Of course, cystic fibrosis begins from the beginning of the life. Yeah.
Yes. Yeah. So, but so he has been diagnosed in 2006, but actually, yes, he has had it since birth. So you don't actually need to say that when you say he was born in 2004. There's no point saying that he has had it since 2004. He was born with it, but you can say it was diagnosed in 2006, which means he hasn't been receiving any treatment for 2 years, and that would be just a good to know information, probably at most, but it's not something for the first paragraph. Mm, let's have a look at that.
Excuse me, doctor. At the writing task, we uh, are asked to review with doctor. Review means refer.
As for a review, yes, this is referral. Yes. Okay, there's a uh, sample by another candidate. I'm writing to refer James, a 14-year-old boy with recurrent pneumonia, in the context of cystic fibrosis, for further assessment of suitability for double lung transplant. James was admitted to respiratory unit on 2nd of February. So, what you said is 15, yeah? Um, Complaining of severe dyspnea, cough, hemoptysis, fever, headache, and facial pain. On examination, he had a respiratory rate of 30, heart rate of 82, temperature of 36.5, and oxygen saturation of 80%. The oropharynx was erythematous, and there was a sonorous wheeze associated with bibasilar crackles. Okay, I don't know how much this actually is necessary.
Excuse me, doctor.
He's
Question in my mind. At the first, this lady told that recurrent pneumonia. We are not supposed to add anything to the case note. In the case note, there is no sign of recurrent pneumonia doesn't tell us about that. Just like nothing medical history, nothing. So can we add something like this? It's
No.
relevant. No.
No. Okay. His chest X-ray showed pleural effusion and pneumonia, and his CT scan confirmed paranasal sinusitis. He was started on azithromycin and ciprofloxacin. James has a history of cystic fibrosis since 2016. Actually, he was diagnosed in 2006, and systemic focal epilepsy. His BMI is 20.5. He has no known allergies. Takes phenytoin, palmozyme, and creon. 4 capsules with food. He has a family history of lung cancer in his father, and his father died of it. Today, James has made good progress, and we had a discussion regarding reducing his school time, using homeschooling, and reducing his hospital visits. And therefore, with regards to the progressive frequency of lung infections, James was advised on daily physiotherapy, regular exercise, and balanced diet. I would be grateful if you could see him for further assessment regarding suitability for double lung transplants. Well, again, I think probably this part is less relevant, I would say. Maybe we don't need that. I think it is relevant to say that he was changed on ampicillin sulbactam for because pseudomonal infection is nasty. And then basically his father died of lung cancer. He was diagnosed in 2006. So these are some um, um, inaccuracies. Okay, and if recurrent pneumonia. I haven't seen the case note, but if it is, I haven't checked it recently. What's the name? I think it is number 5 in the writing. Yeah.
Yes.
Yes,
Number
it's
5.
fine.
Exactly.
Okay. Okay. Focal epilepsy. It's not systemic. It is symptomatic. And poor growth, cystic fibrosis, healthy diet. Well, yeah, it doesn't say recurrence, but yeah, this is 2nd of February, 3rd of February, 17th of February, so it's a prolonged discharge plan. Okay.
So one question in this part, because well, like the reason why I didn't bring the like first set of antibiotics was that in the case note it doesn't say anything like why they changed antibiotics or like what was the growth like was it a culture so I didn't know how to write it like why he received the first day another antibiotics and the second day
No,
they changed it to another
they said that in third of as a patient is stable. When
so
patient is stable, then they change the antibiotic to
so if
oral.
so
Patient is stable.
Okay.
yeah.
Right. But there is another sample here. Thank you for agreeing to see Mr. James Smith, who needs to be assessed for suitability for a double lung transplant. Mr. Smith presented to the emergency department on 2nd of February with severe dyspnea and related breathing difficulties, along with hemoptysis, fever, and facial pain. An examination revealed a sonorous wheeze by basilar crackles, which indicated a lung blockage and mucus at the base of the lung. Therefore, Further investigations were ordered. Mr. Smith was started on ampicillin sulbactam to treat a possible lower respiratory tract infection or bacterial sinusitis and supplemental oxygen. Well, it doesn't make sense. On 3rd of February, scans showed pleural effusion, pneumonia, and chronic sinusitis. Consequently, the antibiotics were changed to azithromycin and ciprofloxacin. Today, on completion of the antibiotic therapy, Mr. Smith is ready for discharge from the respiratory unit based on his condition, cystic fibrosis, and his history of chronic sinus infections. It is likely that there will be further lung infections of increasing frequency. We have discussed the impact of this with the family, especially regarding school, but would appreciate if you could investigate if Mr. Smith is suitable for a double lung transplant. Okay.